Again, this session is being recorded, and while you will have an opportunity to ask questions at any point in time during presentations and then also afterwards, we do ask if you could remain on mute just so that we can mitigate the background noise. We also encourage you to use your cameras if you have them available so we can see your lovely faces. We also ask that you be as interactive as possible. So whether you're actually engaging verbally with us, we also ask that you use your interactive Teams feature such as the chat, react, raise your hand if you have a question as well. And then just to ensure that we have a reduced background noise, we just ask that you try as best you can to mitigate any of the multitasking and background distractions. So we'll start off with some introductions, and we are excited to have two of our mini grant recipients joining us today. We have Valley Program for Aging Services and VPAS, as well as the Beard Center on Aging from the University of Lynchburg. We'll also share any additional partner opportunities and announcements from both us and those on the call. If you have any announcements or anything to share with the broader team here. And so again, I mentioned I'm Millicent Miller. I serve as a health equity consultant for the Healthy Brain Virginia program. And joining me, we also have Rachel.
Good afternoon, everyone. Thank you very much for being here today. My name is Rachel Coney, and I am the program coordinator with the Virginia Department of Health.
Wonderful. Thank you, Rachel. And so as always, we want to know who we have in the virtual room with us. So if you wouldn't mind, if you could drop in the chat your name, organization, and the city or town that you are joining us from today. Right, we have some coming in. Thank you for dropping those in. So we have Joyce is with us. Hi, Joyce. We have Kim from Riverside. We have Dee from Capital Area Agency on Aging. We have Kim Newton from Bristol, Tennessee, joining us. Melissa Long, Insight Memory Care, and some others are rolling in. So thank you, everyone. I see Denise and Christy Jensen. Thank you all who've joined us. And I am remiss if I missed anyone, but thank you, everyone, for joining us. So rounding out our introductions, the weather, at least yesterday and maybe partially today, is starting to get a little warmer. So what is your favorite spring activity? Now that the sun is shining more, hopefully the weather will be warming up and gives us a chance to be outdoors. What are some of the things that you enjoy doing in the springtime?
Gardening, it's wonderful.
Planting, walking and seeing flowers, working in the yard, walking, going for a walk, working in flower beds. Great responses. Yeah, and the weather is going to be definitely more conducive. You won't have to bundle up as much if you're going out for those walks and hikes and maybe walking some trails in our local parks. Wonderful. So as always, I just wanted to bring everyone's attention to the Healthy Brain Virginia program initiatives, as you can see on your screen here. I also want to point out that through our speakers today that will be engaging, we have an opportunity to elevate at least three, some may be overlapping, at least three of our core strategies, which are related to implementing public education about brain health, supporting organizations that incorporate effective brain health information into existing public health interventions, evidence-based interventions, and maybe some newly established brain health programs, specifically in underserved areas within our state. And then also seeking opportunities to improve the knowledge of healthcare professionals by providing the best available evidence on ADRD, caregiving for persons with dementia, and other tools and supports that they have available to them. And so we are excited to have two guest speakers with us today, both of which are representing organizations that have worked with us over the past 2 years as mini grant recipients. And our mini grant recipients have been doing wonderful work as it relates to, of course, educating the general public and caregivers. They've also worked very closely with healthcare providers, and they're just doing a tremendous job as it relates to really elevating ADRD, Alzheimer's disease and related dementia related programs, education to a broader audience. So we are very fortunate to have them and definitely welcome them to our conversation today to share more about the work that they've been doing locally. So our two speakers, we have Joyce up first with VPAS or Valley Program for Aging Services, and then we'll follow Joyce's presentation today with Denise with Beard Center on Aging from the University of Lynchburg. So if we could all give them a virtual welcome, and we'll turn it over to Joyce to start. So Joyce, I will drive your slides if you can just let me know when I should advance.
There we go. Thank you. It's a pleasure to be here, and I really want this to be a conversation. So I will present some information and go over it sort of on the quick side. And then if you have any comments or questions about this, please let me know. So go ahead. I am the programs director for VPAS. VPAS is in the central Shenandoah Valley. You can sort of see on that map the areas that we cover, 5 counties and 5 cities. And we have quite a lot of programs for service. Today, we're focusing on our caregiver support and dementia education and how that ties into this grant. And we serve a lot of people and could serve a lot more if we had the resources. So it's a great pleasure to be here. And next slide, please. So one of the motivations for this effort are the many caregivers that I work with individually that we see in our groups. And one of the comments that has stood out to me so strongly is the feeling of loss that caregivers express even while their loved one is still with us, but they're losing them slowly and feeling like um, they've lost half of their relationship, that relationship identity that gets sort of twisted because of having to be a spouse and a caregiver, or having to be a daughter and a caregiver. And so just trying to work with people with those discrepancies and also educate them is our goal. Next slide. So with our Healthy Brain Virginia grant, we had 4 goal areas: to educate, to integrate brain health, to promote the use of effective interventions, and also educate public health professionals in as many ways as possible, because it's amazing what kind of disconnect we find sometimes between the clinical perspective and the boots on the ground caregiver perspective. Next slide. So a couple of the ways that we have educated about brain health in the year preceding, we did a lot of Dementia Friends and Dementia Friendly at Work presentations. We still continue to do those with some other funding and find that they are very helpful in our work. We are also working really hard to provide opportunities through Tai Chi for Memory, which is a great opportunity, and I'll talk a little bit more about that later. We have virtual dementia tours and dealing with dementia workshops. Those are some of the ways that we provide education for people in the community and for caregivers. And then we are also sharing information with clinical providers through our free clinic, through our federally qualified health centers, and through healthcare practices, and even for, I didn't put it on the slide, but for the Virginia Department of Health here in our area. Next slide. I did want to just note that we have pre-pandemic, we were designated dementia-friendly Lexington, and then in June of last year, designated dementia-friendly Harrisonburg, Rockingham. Currently underway are efforts to connect Stanton, Augusta, Waynesboro, Rockbridge, and Buena Vista, and also incorporating Bath County and Highland County into this effort so that we can be dementia-friendly Valley. And that is directly tied to this grant, because the more we educate people and the more we provide resources, the more friendly we can be to people who are living with dementia and with their caregivers. Next slide. These are some of the tools that we use to give information to health providers that they can then pass along to caregivers. And we have more, but these are just examples of a few of those. So 7 steps to a better healthcare visit, and some information about VPAS and how they can connect people easily. These are both cards that are meant to fit into a provider's pocket or be easily accessible in other ways in their office. Next slide. This is one example of our brain health communications that we have sent out. We'll be developing a completely new set moving forward for this year. But these go out on social media, in some emails. We share them with our cafe members, and just in any way that we can to get the message out in new and different ways. Next. We also have put together brain health packets that we have shared with our cafe members, and those are, our cafes are like a senior center. So with all of our cafe members, with new members, sometimes with staff or board members, anyone where we find that maybe this information could be helpful, we provide this, and oftentimes people keep it for themselves. Sometimes they know someone who needs that more than they do, and they share it or ask for another packet. Next slide. So a little bit about Tai Chi for memory. It is a shorter version of the Tai Chi for arthritis and falls prevention that we teach, and it's quite appropriate for care partners. We have something that we call memory partners. It's sort of like a memory cafe, and we do Tai Chi for memory in those settings with care partners, caregiver, care receiver. We also just offer this as a standalone program, just for people who want to experience Tai Chi, and specifically the Tai Chi for memory. So warm-ups and cool downs, and just a couple of movements that are more simple, but that also provide another way to improve or retain memory and brain health. And what I hear from people, they say to me, I don't know if my memory is better, but my focus and my concentration is better. And it also impacts balance and some other things. So it's a great opportunity for us to introduce people to the fact that indeed physical activity and incorporating certain kinds of physical activity can improve memory and brain health. Next slide. For this coming grant year, we will be working with offering a presentation to Central Shenandoah Health District community nursing staff, and our executive director, Jerry Schaff, will be doing those presentations, talking about recognizing signs and symptoms of dementia, tips for effectively communicating, the importance of treating those living with dementia with respect and patience, suggestions for reducing family and caregiver stress, and introducing them to the VPAS services that might be beneficial for their the people that they serve and run into in their work. We'll also be sharing printed materials for them to distribute to family caregivers as well. So next slide. This is a fairly comprehensive list of dementia education and caregiver services. The virtual dementia tours we have just added, and so that didn't make it to this list, but our Dealing with Dementia workshops are an evidence-based program from the Rosalind Carter Institute. You might be familiar with those. It's about a 4-hour workshop, and we give each caregiver a big 300+ page book of information on being on caregiving in the different stages of dementia. And we have our memory partners events that I talked with you about. They are the first part is doing the Tai Chi for memory activities, and the second half is a social activity, playing games or doing a craft or having a program of some sort. We do have currently one Alzheimer's support group, and quite a few other support groups going on, both virtually and in person. We call them Confident Caregiver Support Groups. And we also have a 6-week program where we give folks the Building Better Caregivers book, and we run through just some basic tools for caregiver health, including emotional health, physical health, asking for help, all of the kind of things that a caregiver sort of needs to keep in their back pocket for the journey that they have ahead. Our Confident Caregiver Conversations is just sort of a fancy way of saying individual conversations with people who aren't comfortable in a group. Respite care and vouchers, we offer people who participate in our caregiver support services respite vouchers for $595 for the year. So we don't advertise this. We don't give it out to anyone who might call, but we feel like it is a part of our menu, a part of our package of caregiver support that we can offer. We have a mediation service, professional legal support, and professional counseling. And then the virtual dementia tour is really an experience. It's not virtual. It's not via the internet or computer, but it's the experience where somebody comes in and they are garbed in a way that mimics how someone might feel who's living with dementia, and they're put through, they're given some instructions to complete tasks and activities that might help the person relate a little bit better to the person who's living with dementia. All right, next slide. All right, so VPAS corporate office is in Waynesboro, and you can reach me via that phone number if you wish. My email is not on this particular slide, but it is really simple. It is joyce@vpas.info. If you have any questions in the future, I would be happy to answer them. And that's really all I have at this time. If you have questions now or you have questions later, however you want to handle that, I'm open to discussion.
Thank you so much for that, Joyce. And if you wouldn't mind, could you drop your email in the chat just so that others can capture it? Perfect. Thank you so much. And so before we turn it over to our next speaker, are there any questions for Joyce and the great work that she's doing at VPAS? All right. Seeing or hearing none, and just double checking the chat. Thank you for dropping that in the chat, Joyce. Feel free if you can't verbally state your question. We'll always check the chat and make sure that we raise your question as well. So with that, we're going to turn it over to our next guest speaker, which is Denise Scruggs from the Beard Center on Aging, who will talk about the work that she's doing.
It's good to be here, everybody, and welcome you. And Joyce, great information. I caught a few things I'm thinking, well, wouldn't that be neat to try down here in Southwestern Virginia? But what I wanted to mention and what we're going to talk about are some of the strategies we took to reach the most people that we can. And as you'll see from the next slide, we're a very rural area. We have over 2,000 miles to cover in our region, which includes the city of Lynchburg, the counties of Amherst, Appomattox, Bedford, and Campbell County, and the towns of Alta Vista, Bedford, Brookneal, and Amherst. And as you'll see from the next slide, our land area, predominantly who we're working with, are rural persons. Greatest difficulty in accessing any resources that are available in Lynchburg or surrounding areas. So that was one of the reasons why when we looked at this particular program and what we could do, we wanted to really get as much information as we could out to as many people as we could to start off with. And then we plan on over the next few years is doing more targeted education. The other thing that I wanted to note that I think is really important, as you can see, the age of our population, our age, almost 1 in 5, or a little bit more than 1 in 5 people in our counties are already 65 and older, which means they're at higher risk of dementia. And therefore, we wanted to make sure again that we did hit those counties for that reason. And also because we know that, again, that they're very underserved. And go ahead into the next one. So what we did when we were looking at doing the program and the education and the projects that we were doing, we looked at individuals in our lower socioeconomic areas, like our inner city areas, particularly in this part 2 of the grant. We're going to go out to our community centers in downtown Lynchburg and our community centers in Campbell County to particularly do some educational programs there. We looked at our minority populations. So as we are looking at churches and as we're looking at a locality of where we have our programs, we're trying to get in to the areas where we have our most minorities, which we know are African American, Hispanic populations are at the highest risk of Alzheimer's and some of the other dementias. So we wanted to make sure that we were able to be front and center there. We also, again, as I said, the rural communities, the older adults, but also homebound adults. Sometimes we forget about the homebound adults who have or don't have the transportation and unable to leave their home for one reason or another. So we're partnering with Meals on Wheels to do some education, also identify if there's any concerns, and also be able to make referrals over to our local area agency on aging and Horizon Behavioral Health, which is our mental health program. Anything that we feel that we can do to again increase awareness in those homes too. That's what we hope to do. And also looking at the prevention or lowering the risk, I should say, because we're not at prevention yet, but we know that now we're seeing strong language of being able to lower our risk by looking at our behavioral habits. And so we have some materials that we put out there, and we'll talk about that in a minute. We also targeted caregivers. We targeted our university students that have family members living with dementia. That was unexpected. When we did some one of our projects, we realized that we had a number of our students that are either taking care of their parents long distance, or they had family members that they had to help take care of in a secondary type of caregiving role. So we are doing some education and possibly even some support groups there for our university students. And we already do some of that for our faculty and staff. So we're going to do something separate for our students. The other thing we started looking at was our professionals that serve individuals with health inequities who have dementia. We know that it's hard to get a lot of the educational programs in Southwestern Virginia. So we really were targeting that population of professionals also. And then also emerging professionals that are coming out of our PA schools, our nursing schools, our CNA schools in the area is also what we targeted there. So the next slide. So when we look at what our goals were, our major goals were education, educating the general public about brain health and also dementia. The second part was to educate the public professionals, because health professionals specifically, but any professional that was interested, we worked with them. And also to increase awareness of resources that are available in our region and also in the state and nationally that people could access on dementia. So we're working on some resource lists and different things like that I'll tell you about here. But let's talk about the VR dementia experience. We purchased the Alzheimer's dementia experience from the Alzheimer's Foundation of America. It's about a 3-minute virtual reality experience that lets you put yourself in the foot of a person that has dementia. And as you look around, you see all kinds of problems in the environment that you can assess, as well as you see how confused that person is just in the part of trying to take their medicine and get started in a day. It did have a profound effect on many people. A lot of people, we work with our students, we work with caregivers, we work with seniors and others, and we did have some good feedback there that they had no idea that that's what happened. And one of the programs, we actually had a person realize that her dad had dementia, possibly because he thought it was just a normal day. That was how his day normally went for what he saw. And so they said, we need to do something. And they expressed interest in trying to get him assessed for dementia after that point. They knew there was some confusion, but they knew they needed to take it further. We also did a brain health educational series. We did 2 classes in 4 different areas around the region so that we would be able to provide general dementia and brain health education in those outlying areas in our region. And we had pretty good turnouts for those. We were really pleased. Again, being able to bring it out there to people, I thought we found really worked. We also did the Alzheimer's Disease and Dementia Care Seminar, which is offered through the National Council of Certified Dementia Practitioners. It is an evidence-based training program for professionals. We were able to offer that too. We also have the Genworth Aging and Caregiving Resource Center that we run out of the Beard Center on Aging, and we created a whole dementia brain health section for people that come in or call in and need resources. We have them readily available to give out. We also are working on, and we started it in the first part of the grant and realized that in our region, we had so much change, nobody knew what services were readily available for persons with dementia or for caregivers. Most of our support groups went away during COVID. We also had a number of companies that were bought and sold or even closed, and a number of new ones that came in. So there was no list that even the hospital could provide for the community. So we're working with local community members to develop a resource list of what brain health and dementia resources we have in the community. Everything from the YMCA and the Parks and Rec programs to what's being done in our university programs for the community and so on, as well as other services. We also distributed 1,000 brain health packets, and we worked with a number of our partners, and we'll talk about who our partners were and how we did that. We used the Administration of Community Living's handout, making, lowering your risk of Alzheimer's or lowering your risk for dementia through lifestyle choices, which was excellent, a fairly new publication that came out just a few months prior to us distributing it. We also gave out information from the Alzheimer's Association on what the symptoms were for dementia, and also the worksheet if you think that you may have symptoms, that you could write down what your symptoms are and take that to the doctor. We also distributed that along with some other publications in that brain health packet. We did work closely with the Alzheimer's Association to do the educational series and also to develop our resource packets. And we worked with some of our community partners that provided dementia care services, and we put some of those brochures in the packet also, so that people would know what is available right now that we knew of for the community. We also we were looking at grocery stores, but the grocery store closed before we could do our program. So we did the library in that same area, that low income area that we knew we wanted to target. We also worked with our local media to do an article, a two-part article in our senior news magazine that goes out to about 13 to 20,000 people. So we were really excited about that. And we did a dementia caregiver survey to identify caregiver needs. So, and our part two, if you guys will turn to the next one, we're really targeting education in the community centers, our local churches. Meals on Wheels, again, is working with us to do brain packets and information to the people that receive meals. We also are working with our university students to do that educational program and possible support group following. And we also are continuing on our resource list. And we also worked with doing little 40 to 60 second brain health minutes that we're going to put up on our website that talk about diet and socialization and all those things that we know are important for brain health. All right, and the next one. But our whole motto, you guys, we're a very small center. I'm a one person. I'm not even full time. I work during the school year, academic year. And I have another person that comes in 10 hours a week. So we have to work hard and we have to work with others to really accomplish what we do. And we were very excited to say that we had some great community partners. We probably hit almost 2,000 people in the first part of the grant. And we hope to, in part two, also reach out to about another 1,000 people through education and information and so on. But this is our motto: alone we can do so little, together we can do so much. Helen Keller has been our model as we do anything in our center. So like the ripple in the pond, and then getting more people involved. And let's talk a little bit about our approach is a three-pronged approach. We collaborated with our community partners. We piggybacked on existing community services and events to put our information out. We didn't feel that we had to create our own events to make things happen. We piggybacked as much as we could. And also we wanted to utilize the media outlets that we knew we had access to. So those were our three-pronged approach. And I'm going to tell you a little bit of who we worked with as we use this three-pronged approach. Again, the community collaborations. And first we're going to look at some of the people that were involved. We looked at our Virginia Department of Health, our Central Virginia Health District department. We worked with local nonprofits. We worked with local businesses who were for-profit. We worked with TV, social media, and senior publications is what we're actually working with right now. Our local area agency on aging was a partner in everything basically that we did. We worked with the Center for Independent Living and our local adult daycare. We had 3 adult daycare communities, and they also worked with us. We worked with Parks and Rec. We also worked with senior apartment complexes, and again, universities and the Alzheimer's Association. These are all things that we looked at for collaborations. And if you look at the next one, I'm going to show you what our local state collaborations were. Actually, here's some more of those: home health services, companion, libraries. Libraries turned out to be our biggest supporter, you guys. Most of our libraries now are doing a lot of educational programming. And what we did was we worked with them on putting our series out in the libraries locally. And now, since then, now we're coming back, not as part of the grant, but we're continuing to do brain health and other types of education and dementia education. We're setting into doing a number of other programs following this because of the relationship that we had doing this grant. So we're very excited to start collaborating with them. Again, we had housing for people who are physically challenged and 60 plus housing that were not independent living, but more, again, apartment complex. Skilled care units, where we work with rehab units that had people coming in. We had packets available to them. And so when people left rehab, they also had brain health packets that they could take. CCRCs. We worked with we only had 1 dementia support group at the time that was running. Right now, I think we're back to 2, maybe 3 this semester. We hope to get to work with them also. Our local health system, which is Centra Health, worked with us also to help us get the word out. Meals on Wheels again. We also worked with the mall. We don't think about our shopping malls, but many shopping malls have walking programs, and our mall program also had once a month an educational service. And we were able for 3 different months to be able to be part of that, distributing brain health information. And we met a lot of people through that Mall Walkers program there. Our Central Pace, our YMCAs, these are all people that we were able to collaborate with. Okay. And as you can see here, these are just a few these are a lot of our government organizations that we worked with. And I've mentioned pretty much all of them now, but as you can see, we tried to go in all of the different regions and who we could look at. Our Parks and Rec, we looked at our libraries and our other government agencies. And if you flip to the next one, you'll get to see more of our business and nonprofit businesses that we worked with: Meals on Wheels, Home Instead. That was another good resource for us. Organizations that are providing care in the home through care services. We were able to put out information. Home Health, again, is another organization that we worked with in several different home healths. And we also went to the School of Nursing with Runkin Pratt, and we did the virtual reality training. And I think that's something that's going to become a regular for us, that each time they have a new class, we're going to help the students go through virtual reality to feel what it's like, and to talk about what the things that they saw and how they would respond to that if they were in the care situation and someone was experiencing some of the situations that they saw. All right. And go ahead with the next one. The other thing that we did, again, we targeted some of the health programs and the students in our university. And we also know that as we get into the second part, we're going to look at our community college that also has nursing and CNA schools there. So the PA, MPH, which is Masters of Public Health, Health Promotion, Physical Therapy, and Nursing, were the majors that we worked with to definitely get them involved in the virtual reality. And while we didn't get every DPT student, we're now it's starting to become part of what they are going to use every time students go through their programs. They're going to have that as part of their dementia training. They will use the virtual reality program for all the students. And we hope to go from DPT to the rest of the programs too. So we were excited that we were able to use those many, many times. And these are just some of the events that we piggybacked on because we found, again, not developing our own events because it takes time. And when you're only a 1 or 2 person office, you can spend lots of time doing that and not so much being able to serve. But as you can see by the attendees, 250 at our Elder Fest, which is the biggest event Parks and Rec does for education. In Bedford, we do a regional health fair. We had 225. But as you can look in each area, how many people we were able to hit, and Meals on Wheels, we're going to hit this term. We're looking at 500. Possibly on Meals on Wheels. So we're going to get a lot of people out there that at least going to get some general information to start the conversations that we can move forward and do more detailed and work with our local area agency on aging and Alzheimer's Association to go back and do some other programs. So we're very excited about that. All right. So our media outreach, a little bit about how we're working with media. We're very fortunate in our area to have a consortium on aging, which at our before COVID had about 80 agencies. We're trying to build that back when we stopped it during COVID. But we're very fortunate to have media support, our local newspaper, the senior news magazine that really goes out way beyond our region, all the way to Radford to Amherst, and our senior guide. They go all across the state. And then we have a TV station that a lot of our seniors look at as the noon station. So we were able to look at the news station, WSET's Living in the Heart of Virginia. And if you're not already using that for education, I encourage you to look at some of that. Even if it's a 10-minute mini program or 5-minute minute, like Health Minute kind of program, we had a huge amount of response after doing that. So we were very excited about that. And then because we work with all of our partners, many of our partners who I showed you in the business and then also the government would put our information out on their own sites. So not only did we hit people through social media through our university, we sent 10 to 20 or 40 times out because our other partners also sent our information out. And that really, again, extended our reach. And that saved us time too, because the more people that did it, that helped us get more exposure with our information. All right, and the next one. So let me tell you a little bit of what our challenges were, you guys. And, we have a lot of challenges. Being a rural area, predominantly rural, we have very poor internet access. We have many people don't have access to internet because it costs so much. And we have many people, seniors living alone without their adult children in our area because adult children are moving to the bigger cities for work. So they don't have that expertise to use computers. So we have to do everything both with hard copy as well as doing what we can electronically to really reach as many people as we can in that way also. The other thing that we know that was really tough was finding ways to reach some of our targeted population. We really spent a lot of time with our partners, tried to come up with, you can get a few people here, you can get a few people here, you can go to this church, you can get, this is a large church. We looked at our mega churches. We looked at our smaller churches. We looked at all kind of ways that we could get out to our community or bring people in via bus or church bus and all to the programs that we were doing. And again, that works out real well. We collaborated with a number of churches that brought their parishioners to our events, like the health fair, and that allowed us to get that information out. So, but we know time limitations were part of that. Workforce staffing shortages when we went to train our professionals, we have a lot of issues in our region with short staff. And therefore, everybody's doing what they can, and it's hard to get a person out of their organization to do the training. And we offered to come into organizations. We were able to do that for a few, but workforce shortages really limited professional education for many. So we started offering some training in the weekends when people could do it on their own, away from the organization. That seemed to work. We had really good attendance in some of our weekend courses. So we had to look outside the box in their timing of that, with that. And then also getting employer buy-in when we were looking at nursing homes or long-term care, assisted living, some of our programs for them, their willingness to let their staff member have a day off to do the training. Because we know when you don't have enough staff, giving somebody a day off really adds to the issues of short staff and quality of care. So if you flip to the next one. So we worked hard on that to really address how we were going to handle those challenges. But I wanted to just say quickly, because I know we want to allow time for questioning. We had some great unexpected outcomes, you guys. We identified when we did the virtual reality, we did it on campus and off campus. Went to different places. We did it in our our community hospital and different places. We found the need for dementia education for our students, more dementia education. And we found that most materials that we have are for the age of 10 up and, considered teenagers with the 10-year-olds. So it was very childish. Some of the materials were not at the level of a college student that might be taking care of their parents, but we needed to also look at how they're handling being in college and all that while they're trying to help out at home. So there's a lot of issues that university and college students and that age of students have while they're, and also the feelings that they have giving up what they need to, or sending money home or whatever they're doing, how that affects their college or their university experiences. So I just want to mention that because I know we need more materials if anybody's ever interested in that. We did strengthen many relationships and partnerships. We have a great relationship with Alzheimer's Association. We talked earlier about, having underserved. We don't have an Alzheimer's office in our area that actually provides education and the opportunity to meet with people. We only do the marketing in our area, and that office actually temporarily closed, so we're not sure. So we're served from Charlottesville to Roanoke. And for people that don't know that or how to get in touch with them or have an internet to know how to reach them, they don't have that resource. It's not there for them. So we do a lot to get those phone numbers out and that kind of thing. The other thing we discovered is that because we got the word out, we got tons of requests to come out. Many senior groups, many caregiver groups. We had many employers ask us to come and talk to their employees. So we had a lot of new invitations that we're passing to the Alzheimer's Association and to others also as the ones we can't do. But the other thing that we noticed too, now we have a lot of our organizations offering their own programs. The Y's doing a little bit more with brain health this year. Our Westminster Canterbury of Lynchburg has started doing a program for its residents, a more ongoing program for its residents. So it increased their awareness, and now they're doing more at their facilities and programs, and we're excited to see that. All right, and go ahead to the next one. Sort of like the ripple in the pond. We threw the rock in, and now it's really going, and you're seeing those that ripple effect. The other thing that we saw is many staff became certified dementia practitioners, as well as taking that class from the National Council of Certified Dementia Practitioners. And that really, we saw people smiling. We saw people excited. For some, that's the only certification they have other than being a CNA or something else. And we know that it can help people in careers. So we were excited to see people that moved forward and did the next step if they wanted to, could do that. And then again, we identified that shift in availability of services. We had no clue that COVID hit us as it did. And we just knew that in all of our partnerships with the hospital and the Area Agency on Aging and our other resources, that we kept thinking we were referring people to places and they were no longer there, or the name changed or the phone changed. And, we were not coordinated in figuring out what to do. And now we're all working together to develop that resource list. And then we already mentioned that virtual reality program helped that family possibly identify dementia in their loved ones. So we were very excited about the unexpected outcomes. And next. And that's all I had to add. We did really enjoy working with our program, and we're continuing it on here in part 2. And I see here, are there any contact organizations or programs in Southwestern Virginia for patients or caregivers with dementia? What we looked at, like, for example, in Roanoke, Carilion Center for Healthy Aging does some programs. We looked at the Alzheimer's Association. Again, we really pushed the resources there. But again, we had to work on phone numbers and brochures instead, because people that maybe didn't have the internet to find those resources, to look it up on the internet, right? To know how to get in touch with them. The other piece that I didn't mention is when we're starting to do this, we're working with Virginia 211 and the Senior Navigator. And our goal, while we're trying to work with this resource list and to know our resources, we're promoting every organization to make sure that they keep their information up to date in those two resources. And I know there's also another resource list our Area Agency on Aging and our Center for Independent Living use. We're also working with them to possibly also promote that one. So our goal is to educate about that too, so we don't get into this area where we don't even know where our resources are. I see somebody saying they're talking, and I will tell you another good resource is our Horizon Behavioral Health. We work with our behavioral health organization. I know I didn't have it there, but you know, they sometimes do programs also that we encourage that with. Okay, and that's all I had for my part.
Great. Thank you so much, Denise. So I'm going to stop sharing my screen so we can get some questions answered. So I'm just going to pause to see if there's anyone who wants to come off mute before we go to the chat.
Millicent, I see there was one question about the grocery store. I will tell you, we started with the grocery store. I put it in that and then circle that we ended up doing at a library because it was right next door to the grocery store. But now we have, you know, we have land, we have food deserts in our downtown area. And that's where we were thinking we'd be able to catch people. And then it went out. So we have even worse food desert, but we were able to get the library that used to be next to it. Not ideal, but that's what we went to.
Do you have any trouble getting the books back, or are you giving them and not expecting them back?
Which books? The materials that we give out?
Yeah. Do you give out actual library books, or do you give out more materials that don't need to be returned?
We use the brochures. We got there's a great flyer from ACL. Excellent, talking about the things people can do to reduce their risk of dementia. And we gave that out, and we worked with the Alzheimer's Association to get a number of their brochures. And then we found one or two other articles that we thought were really good, and we put those out. Yes.
Okay. Thank you. That's helpful.
Great. And then there's a question in the chat from Kim. Are there any contacts, organizations, or programs in far Southwest Virginia for patients and or caregivers with dementia? She's talking about far Southwest, like Bristol or Abington area.
Kim, I'm not for sure, and I'll address that because we have the same issue. You know, our person from Alzheimer's Association works all the way down in that area, but I think that I don't know where they're located. I think maybe Roanoke, so that makes it a little bit harder there. One thing that we started doing, and we are putting in this resource list, you know, almost every dementia has an organization. Lewy Body Dementia Association, the Alzheimer's Association, the Frontotemporal Dementia Association. We put all those together in a handout. And, you know, and when we do this big handout that we're going to do that's listed a lot of resources, it's going to have phone numbers and also support group times and that kind of stuff.
Wonderful resource. Thank you. And then I wanted to go back further into the chat. There was a question for Joyce related to Tai Chi. And looks like Mary Martha asked, where did you find your Tai Chi teacher?
So Megan Bryant is a master trainer for Tai Chi for Health Institute. She's in Virginia, and she does some virtual and some in-person training in Virginia, and I think she goes into a few other states as well. And I don't remember how I found her, but I've been working with her for about 4 years, and she does a great job of training and of retraining and recertifying. And so I would highly recommend her as a resource. And if I have a couple minutes, I can put that information in the chat as well. It is, Tai Chi for Memory is not considered an evidence-based program by ACL yet. I think they're working on it, but Tai Chi for Arthritis and Falls Prevention is, and that is a 16-week series. I will be honest and say, is the only program that we have ever put out to the public where we have had full classes and waiting lists consistently. People love it.
Now, our Parks and Rec does a lot with Tai Chi, and people are, trained to do that specifically.
Wonderful. Thank you both. So I do see that Mary Martha is typing another message in the chat, but until she concludes her typing, I just want to see if there's any other questions.
Well, can I just make one point? And
Sure.
and I didn't say it earlier, but we do have, as I've worked with our libraries, we have talked about putting a brain health and a dementia section in the libraries, and they're all for it. We've just not done it as part of this grant. So I do encourage you, if that's something that you're looking at, that is something we're going to be looking at doing outside of the grant. But as part of it the awareness came as part of the grant. Yeah.
I think that's a wonderful idea, Denise. And we know through our work with other local health districts and other partners that libraries are a tremendous resource, in many areas, an untapped resource. And we've worked with some to do specific education and resources and even screenings as it relates to chronic disease. And so if you have those programs available in your area, it will be a great opportunity to piggyback, using your terminology, specifically as we're looking at risk reduction and comorbidities. And so if you have a library that's doing work on diabetes or hypertension, it could be an easy way to expand that content to Alzheimer's disease and related dementia as well. And Mary Martha says, thank you for providing the email address for Megan. So if we wouldn't mind giving both of our speakers a round of applause virtually or using your reactions, we greatly appreciate the wonderful work that you're both doing, and so glad that you'll be working with us over the next several months as you continue the second iteration of your programming. And so with that, I'm going to just open the floor. We haven't had an opportunity to do this in our past sessions, but we wanted to see if there are any announcements from those that are joining us. Do you have any activities or initiatives that are going on that you would like to share with the larger group while you have a captive audience?
Hi, this is Raymond Beveridge from up here, and it's actually sunny
Yes.
in Manassas, Virginia. And as I put in the chat, after this, I'm going to go out and stand on my deck and let my Energizer Bunny reactivate. I would like to recommend a resource. All the health systems in Virginia have completed their community health assessments, and they have the improvement plans. Virginia Department of Health. The format this year is they're going to take all of them from the 25 health system regions, consolidate into one. But one of the common threads between Centara Northern Virginia Medical Center and, let me get it right, University of Virginia Community Health System. They renamed what they did for up here in Greater Prince William. The number 2 cause of emissions in both health systems was diabetes. And one of the things over here, the report, well, it's been in the news the last 2 days, diabetes and youth, but we're all familiar with type 1 diabetes and then type 2. But the one they're really starting to talk about for chronic disease self-management programs, comorbidities, is type 3. People aren't familiar with that one. That's where sugar builds up in your brains. So now it begin to say the focus, hey, the health systems are saying maybe we need to be working closer on these chronic disease self-management programs that are being offered. But the community health assessment is going to be a big assistance for Healthy Brain Virginia. And as the Department of Aging and Rehabilitative Services does on May 10th, does the Virginia Roadmap. George does his routine in Richmond. So I just wanted to throw that one out there because I've dived into both of them and it's like, wow, this is for community organizations. This is a great time to start pulling this data out because, those people that have money, Denise, those people that have money, and then of course you're with Centra Health.
Yeah.
Centra Health, by the way, they just got partnership. What is it with Life Health, or I always get them wrong, out of Tennessee.
I think it is. Yes.
That for that new behavioral health center.
Mm-hmm.
So
That's right.
So that will be another great opportunity. But Centra, all the health systems have foundations, another place to raise money. So thank you. This has been a great series.
Wonderful. Thank you so much for elevating the use of data and those resources. They're tremendous. So yes, I agree. If you haven't already tapped into your local health system's community health needs assessment, or your local health department's community health assessment or community health improvement plan, or just statewide plans, those are definite opportunities. We have also, over the past 2 years, we've also increased our data collection on the national level using behavior risk factor surveillance not only funding, but also the dissemination of those national surveys. And so we will have data available related to social cognitive decline and then caregiver as well. And so those will be published over the summer. We'll be able to share more information about that. And if you're looking for specific data within your region, on the VDH website, we have a data portal where you can go and actually request those data as well.
And I forgot something else from VDH because it should be coming up posted. The Virginia's HIV care plan. This year, Audrey, on a suggestion, they've integrated with the graying of HIV. And of course, that's 50 and older they are talking about, although the youngest in the state, I think, is 14 years old with HIV. But how the research, we got to have everything evidence-based, that it's coming out, the impact of HIV AIDS on the long run and relation to ADRD, which is kind of exciting opportunities there also.
Thank you so much for
Yeah,
that.
I don't
Again,
sleep at night. I want,
I
a
see.
couple hours. So military habits, you wake up, you start reading things.
And can I mention another quick resource? The National Alzheimer's and Disease Resource Center publication just came out in last May. Dementia Training Resources for Professionals and Volunteers. Excellent, excellent resources that you can use that are evidence-based and free. I use it all the time.
Thank you so much, everyone. We definitely appreciate the formal sharing by both of our partners, V. Harrison Beard Center, as well as the wonderful announcements and suggestions for resources. As always, if you have any questions or want to get connected with us, I'm going to flash Rachel's contact information for you to jot down. If you already don't have her email saved in your contacts, please feel free to reach out to us. If you come across any resources that you would like to share with the broader group, we'd be happy to disseminate those. And so again, we do thank you for being a part of our series. And we're looking forward to being able to connect with you in the very near future. So please be on the lookout. And again, thank you so much. We'll be sharing the recording so that you can disseminate that to all of your partners and colleagues as well. Thank you for your time today. Have a wonderful evening.
Thank you.
Mm-hmm.
Okay.